the numbers have been climbing for a couple of weeks, but we've seen a real escalation this week in the numbers. First, let me just take you not to today's numbers, but to where we've been going. And you can see it looks a little bit smaller on this chart, but for a couple of weeks now, the weekly figures have been going up on a national scale. And just remember, we now get weekly numbers, not daily numbers from all of the states and territories, a slightly different way that we think of things, and those numbers get reported on Fridays. So today, we don't have every state and territory yet reported, but let me just show you the two most populous states, which report first thing in the morning. And what we've got here is 19,800 cases in New South Wales in the past week. It's up from 12,450 the week before, so I can do the maths for you. That means cases this week are 59% higher than they were the week before. And in Victoria, it's a similar situation. We have 16,636 cases reported this week, and that is 62% higher again than what we saw in the 7 days to last Friday. So while we've known cases are shifting up, what's become really clear this week is that this is a significant new wave, and we've seen significant warnings from now most of the states and territories that this is underway. Let's have a listen now to the New South Wales Chief Health Officer, Kerry Chant, and also the AMA.
I can confirm that we are entering the fourth wave of COVID for 2022. We have seen a gradual uptick in cases, and we are seeing some movement in increasing hospitalisations, and a slight increase in ICU from a very low base.
It's back to that messaging of putting masks on indoors, staying home and isolating until you're not infectious anymore, making sure those boosters are up to date because those numbers really aren't where we'd like them to be, and getting treatment, talking to your GP if you test positive to make sure that you've got access to treatment.
So, Casey, when will we see the impact of this new wave in hospitalisations and, of course, deaths?
Well, as Kerry Chant just said, hospitalisations, we're actually already starting to see an impact there, but it's going to get higher. So this week we have 974 people in hospital. That's as of yesterday afternoon, up from 809. So 170 more in just 1 week. And when your cases are going up by 60%, well, that means we're likely to see hospitalisations rising by more than what we've seen as well. I know a lot of people are probably yelling at their television, yes, cases are up, but we don't know how many exactly there are in the community, and that is correct. But from week to week, we're pretty confident when we see a shift that big, yeah, we're seeing a lot more virus in the community. And anecdotally, I think a lot of people are seeing, you know, a lot more friends, family, contacts, acquaintances testing positive with COVID as well. Victoria as well, that's going from 274 people in hospital as of the latest update, up from 231. So a slightly more modest increase there, but a significant and noteworthy one nonetheless. And I guess the question then is, yeah, how much of that will show up in these deaths? I imagine they will increase in the coming weeks. 22 were reported in New South Wales last week, 24 the week before, so no major change there just yet. In Victoria, a slight, sorry, that's hospitalisations again. I don't have deaths, but in Victoria, again, not a significantly jump this week, but we know deaths lag hospitalisations, which lag cases. They are coming down the line. We just don't quite know how many yet. They're the reports from the two most populous states. As I say, not every state's yet reported, but they will all through the course of the day. We'll bring you the national figures when they do get tabulated.
OK. Casey, thank you.